How's it going? My name is Cappi, and when given the choice to pick from my discussion forums, I chose the topic what it means to pull a plug. So let's backtrack a little bit. What does that phrase mean? That phrase means to take someone who has lost all quality of life off life support. And what is life support? Life support is artificial breathing. When you're hooked up to a machine, and the machine is basically breathing for you, and all your life depends on that machine. So what does it mean to be brain dead? So after doing my research, here's the definition that I found in brain death is when a person on an artificial life support machine no longer has any brain functions. This means they will not regain consciousness or be able to breathe without life support. A fact that I learned after doing all my research is that once diagnosed with brain death, the patient is considered to be legally dead. So by law, once you're diagnosed, at that point you are considered by law to be dead. So obviously, it's a difficult decision. It's easy for me to talk about it, especially like when I'm not faced with a decision. But it's a life-changing decision. It's a life-changing decision for the patient, obviously, and not only affects the patient, it affects the families involved, loved ones, friends, anyone involved with the patient whatsoever. So how is it determined? How is an important decision like this determined? Well, there are multiple steps and multiple tests taken. First of all, it is the final decision is made by two senior doctors, usually not at that hospital. The EEG test is a very common test when the doctors are concerned about seizures. This test measures the electrical brain activity. It's looking for any activity in the brain. And there's the transcranial Doppler. This test uses ultrasounds to look for blood rate, how fast it's going, what direction, if there's any blood flow at all. They use ultrasound to find that. So what causes these? It's not a sickness, not a virus, but you can do it from a physical accident, like getting in a car wreck or a bike crash, falling on it, your head. There's a bunch of stuff. So the technical cause for it is when blood and oxygen is cut off from the brain. So that means stuff like brain hemorrhages, bleeding in the brain, heart attacks, strokes, blood clots, and brain tumors. Those are all causes of brain death. So, what would I do? It's really easy for me to say what I would do when I'm not faced with the decision of choosing to keep my family or bring on life support or not. But here's what I would do. If I was faced with a decision, I think the best thing to do is to pull the plug when pronounced brain dead. I think this is the best decision because the patient who is diagnosed with brain, they're diagnosed that their brain is dead. I think this is the best decision because they lost all quality of life, and you gotta pay to keep them on life support. So that can be draining financially. So why did I pick this topic? I picked this topic because it's a difficult question, and who knows, maybe one day I'm faced with a decision. It's a real world case scenario. So I enjoyed doing my research on this. I enjoyed doing my research on this, and I hope you learned something. because I really enjoyed making this video, making my notes, and writing my one-page summary. I hope you enjoyed it as well. Thank you.